there are between 5 and 6 million Canadians who are actively searching for a family doctor who can't. Many have been searching for years. And we're actually expecting that number to grow, right? The pandemic has been so difficult on so many people, including, of course, healthcare workers, and family doctors and primary care workers are amongst them. They've had higher rates of burnouts. Retirements are increasing at a faster rate than expected over the past few years. And we're seeing few of our graduates choose comprehensive family medicine. And, this gap of, it's about 17% of Canadians who are looking for a family doctor who can't find one. That's, of course, not evenly spread out through the country. So there are some provinces where it's particularly bad. So, for example, in BC and in Quebec, it's 1 in 5 residents in those provinces. And even within provinces, this lack of access to primary care, it doesn't affect everybody equally. So, for example, there was a great story in the Globe that was informed by some researchers based at Queen's, and they found that if you look at the highest income on people in Ontario, about 12% of those folks didn't have a family doctor. But when you look at the lowest income Ontarians, that number is almost double. So 20%. And there's a similar gradient between people who are racialized and people who are not racialized. There's been decades and decades of research that have shown that if you want a high functioning universal healthcare system, then a high functioning primary care system has to be at its foundation, right? It improves population health for everybody, and it disproportionately benefits equity seeking communities. When Tommy Douglas kind of laid out his vision for a universal healthcare system, the first phase was to remove the financial barriers to care. And at least for doctors and hospitals, by and large, that was done. And that's the reality that for those two, we are constantly trying to protect and preserve. But his second stage is one that was never realized. And the second stage of Medicare, he viewed as one that was much more ambitious, a fundamental restructuring of healthcare delivery to include a greater focus on illness prevention and health promotion. So that's where we need to go. We need to think of a fundamental rethink of primary care that's oriented around team-based care, because, of course, primary care is not like it was in the 40s, 50s, 60s, et cetera. It takes a team now. It's much more complex. We need to use technology, including virtual care, as a tool in the way that we do primary care that's integrated into, a longitudinal relationship with your doctor or nurse practitioner, not a walk-in clinic style. And there's also things we need to be on guard for, things like concierge care, like the intrusion of investor-owned for-profit care. We're seeing large Canadian corporations get into this business. So it's a matter of playing both offense and defense here.